Hello everyone, and welcome to this audio or podcast, an overview on on works relating to nephrology and public health. And I'm going to provide an overview around long-term conditions and healthcare inequalities and kidney care for all in support of World Kidney Day 2022. This is works that has been is a collaboration between the renal patient the RPSG, the renal patient support group, and also the kidney disease and renal support group, or KDARS for kids. This is an overview that has been accepted for accepted as an online overview in way of an abstract, which would be available, which would be made available through the American Society of Nephrology, the American Society of Nephrology website, and will be available from mid-October 2022. So will be available to view through the American Society of Nephrology. And so I'm going to provide an overview around this as well. So, um, so a little bit of an introduction and some context around aims and objectives. So it has been in context of the introduction around it. Has been reported that patients with long-term conditions sort of account for around 50% of general practitioner appointments, 64% of outpatient appointments, and around 70% of hospital bed days. Around 70% of total health and healthcare expenditure, at least in the United Kingdom, has been attributed to people or patients with long-term conditions. Education and consultations through online spaces where patients have access to peer support and allied health professionals' involvement would potentially prompt smarter care. Providing chronic kidney disease patients education that is centered surrounding clinical and non-clinical scenarios is important, owing to changes in health and disease over time. Health professionals are prompted to keep up to date and aspects that surround at-risk patients and consult nephrology guidance where most applicable. So a stance is required where healthcare education interventions constitute service equality and improvement. So in context of that, so I'm going to highlight some aspects of definition. So healthcare is best when there is a position to deliver the NHS, at least in the United Kingdom, the National Health Service long-term plan aim to take a long-term plan for triple integration, which is triple integration of primary and specialist care, which around physical and mental health services, and especially if connectivity, aspects of connectivity are unified through 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 electronic, so through patient electronic patient records, but also through the National Health Service or NHS, and also in context with a health and social care network, or HSCN, and this can allow interconnectivity in healthcare that meets compliance. And so the HSN also provides the underlying network to help integrate and transform health services by enabling care organizations to access and share information more reliably, flexibly, and efficiently. So some of the aims around this work was to identify, number one, whether patients with chronic kidney disease would like to approach health professionals and patients and patients through online consultations and educational support, thus prompting collaborative efforts. And number two, understand if and whether CKD patients would welcome more integrative support from healthcare professionals through social media, wherein patients and professionals can bridge gaps across health inequalities. So, in relating to this, uh, I'm now going to highlight a little bit around healthcare aspects of healthcare complexity. So, in line with this, an estimated 15 million people in the United Kingdom have at least one long-term health condition, with the prevalence of cancers, chronic kidney disease, and other conditions increasing more quickly. And it has been predicted that the number of people with long-term health conditions will remain relatively stable over the next 6 years or so. Although the number of people with multiple long-term conditions, known as multimorbidity, is set to rise, has increased and set to rise from 1.9 million in 2008 to 2.9 million in 2018, and this consequently has had an impact on health and lives, and already the 30% of the population with long-term health conditions again have accounted for 70% of NHS or National Health Service spending. So reducing people's dependence on health professionals in some contexts, and increasing their sense of control and well-being is perhaps a more intelligent and effective way of working. Despite overwhelming evidence, people with long-term health conditions or disabilities can face several challenges regarding discrimination and or ignorance, and people may feel disenfranchised and have perception of there can be perceptions of helplessness and feelings of powerlessness against a backdrop of diminished health. So I'm now going to highlight a little bit about sort of population healthcare education and online spaces and portals in context of health and the National Health Service in the United Kingdom. So first announced in 2003, the terminology population health was used to describe health outcomes surrounding disease trajectories across health conditions. Population health has now progressed to include identifying people at risk of long-term conditions according to severity of illness, demographics, and broader bioinformatic parameters to identify risk in leveraging resources to improve healthcare and outcomes. In context of healthcare education, so healthcare education has diversified for patients with long-term conditions over the past 2 decades. Patients with long-term conditions use the internet to access peer support groups and through social media, and whilst through social media platforms, and whilst this can be helpful, peer support alone do not override the necessity for educational support. And it is in this context patients become more informed as decision makers, or misinformed around disease trajectory, leading to compromised quality of care. In context of both population health and healthcare education, I'm now going to highlight a little bit around online spaces and portals. So online spaces have allowed patients with long-term conditions to access supplementary information related to health and disease, including the National Health Service website and portals, and patient-based organizations and various other sources. The current concern is that despite technology advances, integration between information searching versus knowledge implementation differs between age groups and across long-term conditions. Information available over the internet is vast, and much of it can be daunting and lead to educational barriers. The problems which appear in healthcare have risen from a lack of understanding about the multidimensional nature of patient and public involvement. So in context around this, I'm going to highlight some aspects in relating to shared decision making, challenging inequality, and then some conclusions as well. So some context in related to information, communications, and technology. So reducing people's dependence on health professionals and increasing the sense of control and well-being is again perhaps a more intelligent way of developing joined-up thinking between patients and health professionals. And there are a range of initiatives to support self-management, including information leaflets, online peer support, to one-to-one counseling, group education sessions, use of social media platforms with some aspects of technology, and self-management interventions. Initiatives can be categorized along a continuum with passive information and provision about people's condition and technical skills at one end of the scale, and initiatives that more actively seek to support self-management and increase self-efficacy at the other end of the continuum. And in context of shared decision making, in context of shared decision making, patient and public involvement, at least where in context of research, this helps in the bridging gaps between health professionals, scientists, and patients. And the involving of patients in healthcare is an ethical requirement, since patients pay for services, so they should have an influence on healthcare together with health professionals and across the sciences. So in context of this as well, I'm going to highlight some conclusions as well. So patients are the intermediaries between primary and secondary healthcare services, and chronic kidney disease patients now have more opportunities to share lived experiences owing to the nature and implementation of social media platforms like the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, or KDARS, for kids. In addition to sharing experiences, this prompts patients to be more than mere recipients of healthcare, and chronic kidney disease patients become more empowered, so that more informed decisions can be made. And so with that, I will end this sort of overview in this podcast, audio and podcast. This work again will be available through the American Society of Nephrology website from mid-October 2022. The poster, or the research poster, will be made available, should be made available or accessible through the Renal Patient Support Group RPSG ResearchGate page. And any particular follow-ups around this work, feel free to get in touch with. Feel free to contact the RPS, the Renal Patient Support Group, the RPSG, or KDARS, and this overview will also be made available through the different social media platforms, as well as the different social media links, as well as the RPSG, the appropriate RPSG YouTube channel. So thank you for taking the time to thank you for allowing me the opportunity to provide this overview, and hopefully it has been informative. Thank you.